Hello, welcome to Doctor Talks. This is your host Vivek. Here we chat with the best doctors about diseases and conditions they treat. Our guest today is Dr. Jagdish Hiremath. Dr. Jagdish Hiremath is a well known cardiologist based in Pune. Welcome, Dr. Jagdish.
Hello, Vivek. Thank you for inviting me for Doctor Talks.
Dr. Jagdish, though you need no introduction, but for the benefit of our listeners, it would be great if you can share your journey in the field of medicine and specifically cardiology.
I'm a product of Pune, educated here up to schooling in medical college, and did my MD medicine from Sassoon Hospital, BJ Medical College in 1983. Went on to do my DM cardiology in Mumbai. And then 1 year I spent in Melbourne, Australia to learn the tricks of coronary angioplasty. And that's been my expertise or bailiwick. I've been practicing that for last almost 31 years in Pune. I also went on to get some more degrees and some fellowship from US. So my practice has been interventional cardiology, which involves more of angioplasties. But I enjoy overall cardiology, and it's been an extremely pleasurable journey. Cardiology is a vibrant field. It gives you a lot of job satisfaction.
Thank you, Doctor. Today, can you give us an overview of cardiac imaging and its role in heart treatment?
The cardiac imaging itself is a new subject for most people who are not tuned to medicine as such. They know about heart attacks, they know about ICUs, they know about bypass surgeries, angioplasties. But overall, cardiology deals with hearts. It's easily the most important organ of the human body. When the heart stops, it is dust to dust. So when dealing with the heart, the treating doctor has to get excellent data or information so that right steps are taken. Cardiac imaging is one such field which gives vital information to the treating cardiologist. In many cases nowadays, imaging becomes a turning point of treatment, outcome, and future of the individual. Fortunately, imaging of the heart has improved leaps and bounds over the last few decades. Other investigations like some blood tests, they will give some selected information. ECG, stress test, Holter will give another set of information. Technically, echocardiography, coronary angiography are also imaging techniques. They are, of course, well established and have been around for decades. Cardiac magnetic resonance, CMR, or CT scan of the heart have heralded on the scene. But today, what we are going to see is cardiac imaging based on nuclear medicine and how it has enhanced precision of decision making. Nuclear imaging of the heart involves a radioactive nuclear tracers. This tracer is injected in the body through the vein. It travels through blood and spreads in the heart through heart's own blood supply. A special camera, the gamma camera, takes pictures from outside the body. Thus, it's a non-invasive test where the body is not invaded by tubes or probes. The gamma camera can pick up areas that are highlighted by the nuclear substance. These images are then interpreted by the nuclear medicine experts who are actually trained physicians and have specialized postgraduate training. They handle the radioactive substances also. Nuclear imaging is used in all parts of the body, but for heart, it can bring in wonderful niche information and help us cardiologists plan a precise therapy almost in 10 to 20% of our patients.
Can you illustrate a case where nuclear imaging enabled a better informed treatment approach?
Oh, there are many, but I have selected a few for the audience today. The first case I would discuss is a fairly commonly discussed occurrence in heart patients. Mr. T, we call it for convenience, otherwise a normal individual. He underwent a routine executive checkup at the age of 40 as a part of his company's checkup. Treadmill test, which is normally done in such executive checkups, came abnormal. An abnormal treadmill test indicates blockages in the coronary arteries. So Mr. T underwent a coronary angiography and found to have a block of about 60% in one of his important arteries. So the narrowing was 60%, and that started a long discussion process. At a young age, there was a dilemma whether to provide only preventive care or subject him to angioplasty with a stent. In short, the importance or the significance of the narrowing of the lesion was doubtful or borderline. A less than 50% lesion was a straightforward decision not to do anything. A more than 75% would have been clearly an angioplasty. But these borderline lesions always churn out a lot of muddy water. Nuclear imaging was used to solve this dilemma. Mr. T again underwent a treadmill test as before. At the peak of his walk on treadmill, when the highest heart rate was achieved, thallium, which is a radioactive nuclear substance, was injected in his arm. The thallium reaches the heart and spreads along the blood flow to all three areas of the heart, which are supplied by the three major coronary arteries. At this stage, gamma camera, which is like a scanner, took various images of the heart in various slices of the heart. These slices are important because heart is a three-dimensional structure and it's interrogated by a two-dimensional modality. This done, Mr. T was made to come back to the nuclear medicine department after 4 hours. By this time, the thallium gets stabilized in the heart and the gamma camera then repeats a series of images. This process takes about few minutes while the patient is lying down quietly. The nuclear physicist now compares the two sets of images and gives us cardiologists the final impression. If the thallium lights up the area, it is called hot, and if it fails to do so, then it is called cold. Mr. T had all his areas hot from the beginning. If Mr. T's block was important or significant, causing flow restriction to that area would have remained cold in comparison to the brisk flow of the other arteries, which were normal. After 4 hours, the blood would finally reach the restricted area, get redistributed, and then would become hot. In technical terms, the ischemic area, that means the area with less blood flow, would be cold at peak exercise because at a high rate and work done by the heart, and it will slowly become hot over a period of 4 hours. In Mr. T's case, it never remained cold to start with. It was inferred that the 60% block was not important. It did not require any mechanical treatment like a stent. Mr. T was advised only preventive treatment. The thallium treadmill test was a game changer for him. He went on to become CEO of the company the next 10 years, repeated his thallium test 3 times in the next 10 years, and it was all the time normal. In normal treadmill tests raised the suspicion. Coronary angiography gave a borderline verdict, but the thallium provided the right direction. We commonly say that the normal treadmill is a sessions court, thallium is a high court, and angiography is a Supreme Court. But here, the High Court turned the tables on the Supreme Court decision.
Very interesting and insightful case. And the analogy which you gave in terms of Sessions Court, High Court, and Supreme Court made it pretty clear. I'm tempted to request you for another scenario which you can share.
Another use of thallium-like radioactive agent is to check viability of the heart. The heart muscle or the myocardium is an active living cell. It produces glucose and energy, and this is known as metabolism. If the myocardium is metabolizing, it is living or viable. If it is dead, it will not metabolize. When a specific radioactive substance reaches the myocardium through blood, the cell activity takes it up by metabolism. So actually, it's like absorbing inside the cell. Thus, the cell becomes radioactive, hot, and is captured as a lit area on the gamma camera. If it is dead, thallium will not enter the cell because there is no metabolism. Area of the heart will remain cold, unlit for the gamma camera. A fantastic life-saving use of this viability test took place a few years ago in Diwali. A 10-year-old boy, over-enthusiastic, decided to light up his home with colored bulbs, mishandled the electricity, and got a massive electric shock. He got flung for about 6 feet and became unconscious. His pulse was feeble, his heart was racing, his echocardiography done showed an electrocuted heart. It was hardly moving and was about to give up. Doctors proclaimed a near-death situation. On the insistence of the mother, almost a corpse of the boy was brought to a bigger hospital. It was quickly realized that time was running out. The first test was a viability study by the nuclear medicine. Within an hour, we got a report that the heart was viable, it was not dead. It was only stunned by the electric shock and was in a state of weakness, not contracting. This prompted us to place advanced life support despite the poor finances of the family, because now there was hope. All that needed was to prolong rest to the heart and let it recover on its own, because there are no magic medicines for such a condition. We installed a balloon pump in this 10-year-old child for support of the heart, and within 48 hours, everything started improving. And after 7 days, a corpse-like boy walked home with an ecstatic mother. All Diwalis now, our team gets homemade mithai from this family. The nuclear imaging helped us to employ this expensive treatment because it gave us hope that if supported, the heart will recover, and it did.
I'm amazed to hear this case. It shows the power and potential of technology coupled with medical expertise. It will be interesting to know more about other possibilities, scenarios where you have used nuclear imaging to manage complex health cases.
Yes, modalities like the thallium, as we discussed, the PET scan, the positron emission tomography, cardiac magnetic resonance CMR, and stress echo are all the tests which ascertain whether the heart is alive or dead and can perform the viability test. They all have their merits and demerits, but when used judiciously, they provide this vital information, especially when the heart has become very weak. We've had instances when a patient with multiple coronary blockages and a very weak heart was sent for a bypass surgery. Obviously, this is a very high risk case, and the death on table on such a case would be very high. Turns out that the PET scan of the heart is non-viable. That means the heart is all dead. So bypass surgery will not be of any use at all. In fact, it would prove fatal. This person then underwent a heart transplantation instead, and now he is well for the last 2 years. Other way around, a poorly pumping heart was relegated as end-of-life treatment and was found to be extremely viable on the PET scan. One single crucial angioplasty turned the tables on this person. Now he runs half marathons. From viability and lack of blood supply, that is ischemia detection, let's move on to some unusual utilities of nuclear medicine in cardiology. It's a highly specialized field, but now getting used more and more. A 24-year-old lady came to us with a blood pressure of 200 by 110, which is alarmingly high for her. She and the doctors had been struggling with it for the past 6 months. Career, marriage, pregnancy were all on hold because of a volatile blood pressure. We subjected her again to a PET scan. To our pleasant surprise, a tumor called pheochromocytoma, no, name is not so important, was detected at the spot of her right kidney. She underwent this tricky but effective surgery of removal of the tumor. The blood pressure vanished, and now she is a happy mom with 2 kids and has stable job in a bank. This reminds me of another high profile lady in her late 40s. She had a pacemaker implanted for a slow pulse rate. After a few months of the implantation under the left collarbone, she started running low grade fever and mild pain at the site of the pacemaker. As cardiologists, one is very wary of pacemaker infections because the wires are in direct connection with the heart from inside. And any infection, the germs can travel along the wire electrodes and it can become a major life threatening medical emergency. Here, in this lady, we had to be sure that there was infection at the site and also whether it had traveled inside her heart or not. A PET scan effectively showed us that a minor spot of infection was at the pacemaker site below the collarbone, and not even a trace of infection was noted inside her body along the wires. This made us confidently treat her with a short course of oral antibiotics. If the PET scan had shown us infection along the electrode or in the heart or the heart valves, we would have had to resort to 4 weeks intravenous heavy antibiotics, removal of and re-implantation of the pacemaker. This was all avoided due to precise test to detect the infection, the nuclear imaging by positron emission tomography, the PET. Of course, this is a very expensive PET to have, but bigger institution would manage that. Thus, actually, nuclear imaging has come of age. It forms a turning point in decision making in cardiology in about 15 to 20% of all cases. It's a non-invasive, safe modality, and for the information offered, it is highly cost effective. I, as a cardiologist, feel privileged to be practicing in today's era of this advanced technology. I've seen the transition. In the olden days, there was nothing of this kind of imaging. So without these nuclear imaging, the clinical decisions were made on gut feeling, on experience. They all were well intended, but always had a subjective element of error. Nuclear imaging has added remarkable objectivity in decision making of these cases, and the transition of using and not using nuclear imaging leaves me Twitter-pated, absolutely excited about management of patients.
Oh, very rightly said, Dr. Jagdish. We as common men at times wonder why these tests are required. But as you have highlighted, nuclear imaging helps medical experts like you to make much more informed decisions. Thank you for taking us through various kinds of imaging techniques and specifically nuclear imaging and helping us understand their importance by sharing your case experiences which leveraged imaging technology. It was a pleasure to have you as our guest on Dr. Talks. Thank you.
Thank you. Thank you, Vivek. It was my pleasure to be on Dr. Talks. I hope it was not too technical and simple enough to understand.
Yes, it was. I'm confident that our listeners would be able to understand the importance of cardiac imaging and specifically nuclear imaging through your simple illustration. Dear listeners, hope you enjoyed our insightful session on cardiac imaging and the important role it plays in today's era. Kindly share the podcast with your friends and spread the awareness in the community. Cheers till we meet next time.